Hello, today we'll start the routes of administration. See, route of administration is from which path we have to take the drug to the body. So, when we talk about the following categories, there is systemic route and second is a local route. So, on the basis of systemic route, they have been antral and parenteral route. In systemic route, there may be the site of administration could be another site, but the drug ultimately reaches in the blood. So, enteral route contains oral, sublingual, rectum, and parenteral route includes IV, IM, subcutaneous inhalation. So, systemic route is again classified into two classes, that is an internal route and oral route. Internal route is that the drug is placed in the GIT or any other site of administration and then it absorbs in the blood. So, this route is further classified into oral, sublingual, and rectum. In oral route, the drug is placed in the mouth and swallowed. So, the advantages of oral route is that is convenient, absorption, and cheap. Convenient as it is a pain free, easy to take. Absorption is it takes place along the whole length of the GI tract. Cheap is compared to the most of the parenteral route. But some of the disadvantages of the oral route is sometimes a drug is insufficiently absorbed, first pass effect, irritation to the gastric mucosa, destruction of drug by the gastric acid and digestive juices, and effect too slow for emergencies. If we have to have emergency, we would like to for a parenteral route, unpleasant taste of some drug and unable to use in the unconscious patient. So the disadvantage of the oral route is the first pass effect. First pass effect occurs only for the oral route. In this term, the drug is delivered to the liver via portal circulation, so the metabolism of pharmacological agent takes place and the absorption becomes less due to the less bioavailability. So the greater the drug passes to the first pass effect, the less will the agent reach in the systemic circulation. So examples of the drug which undergo fast first pass effect is imipramine, propranolol, and lidocaine. Examples of the doses formed by oral route is the tablet, capsule, syrup, sublingual buccal route. So in sublingual route, the drug is placed under the tongue and it is taken without the use of water. The tablet disintegrates under the tongue and the absorption occurs in the mouth. So this is called sublingual route and the example is nitroglycerin tablets. In the buccal route, in this administration, drug is kept in the buccal cavity where it disintegrates and absorption occurs in the mouth. The advantages of sublingual and buccal route is the rapid absorption and the drug stability. It avoids the first pass effect. But the disadvantages are it's inconvenient to cap the drug in the mouth. So inconvenient. Only a small size is required to keep the drug in the mouth. And the drugs having unpleasant taste cause problem because the drug is kept in the mouth. Next one is the rectal route. In rectal route, the drug is administered orally, can also be administered rectally by making a suppository. In a suppository, the drug is mixed with the waxy substances which dissolves and liquefies after it is inserted into the rectum. So the wall of the rectum is thin and rich in the blood supply. So a suppository is prescribed when the patient has a tendency that he can't take food, he has a nausea, he couldn't swallow. So for the drug that are retaining suppository form may be given by an injection. Next is the vaginal route. Vaginal route is generally used for to deliver drugs like estrogen to the woman to the menopause or hormonal related drugs, and generally for the infectious drug, antifungal, anti-infectious drug is given by the vaginal route. Next is the urethral route. In urethral route, a drug is given to the urethra and is generally suited for the unconscious patient and the children, or if the person has a tendency to develop nausea or vomiting. So it is cause the disadvantage is it cause irritation and absorption may be variable. Example is suppositories, vaginal bogies, urethral bogies. Now, coming to the parenteral route, in this route, the drug does not pass through the GI tract, it directly reaches to the blood. It can be further classified into two classes. With an injection, which we given that IV, IM and subcutaneous, and without injection, in this the drug is administered without the use of injections or inhalations. So with injection, very well, you know, IV route is directly taking the blood in the help with the help of injection, and absorption phase is bypass. So precise, accurate, and almost immediate onset of action could take place. Disadvantages is the pain at the site of injection, great risk of the adverse effect. Next is the IM route. In this route, a drug is given into the muscles. The muscles could be deltoid muscles or gluteal muscles, and increases the rapid absorption of a drug in an aqueous solution. So, when we talk about the IM route, general depot form of the injection has been given to the patients. Next is the subcutaneous route. In subcutaneous route, drug is given into the subcutaneous layer with the help of injection. So, when the drug reaches to the subcutaneous layer, it crosses the membrane and absorbs into the blood. So subcutaneous can be used by without injection. This is subdermal, in which the drug is mixed with the propellant, and at the high velocity when it is pressed, the drug is absorbed into systemic circulation by the pores. So the examples are inhalers, aerosols. So local topic of the drug administration is the mucosal membrane, skin. Mucosal membrane contains eye drop, antiseptic, sunscreen, and skin includes the dermal, transdermal. So this is all about the various routes of the drug delivery. So skin, there is we use also the cream, locals and lotions and gel for a particular time effect, and but for this, transdermal is one of the approach that employs the delivery of the drug that is subjected to first pass hepatic metabolism into the transdermal. The various barrier of the barrier of the skin is the stratum corneum, and due to this, transdermal allows to permeation of the drug with the help of use of the permeation enhancers, and the drug is directly reaching to the systemic circulation. So thank you for this.